Namaste. I am Dr.PRIYA Jain and I am working as a neurodevelopmental pediatrician in Indraprastha Apollo Hospitals, New Delhi. Today I will be talking on autism spectrum disorders.
Autism has increased exponentially worldwide over the last 2 decades. The WHO estimates that 1 in every 100 children is diagnosed with autism. Autism basically has a neurological origin. The structure of the brain is fairly normal, but the connections within the various functional areas of the brain are abnormal. That means the wiring and thus the receiving and transmission of signals within the brain are faulty in children with autism. This leads to the two main manifestations of autism, which are basically lack of social and emotional communication and certain ritualistic and repetitive behaviors which are seen in these children. As parents and caregivers, you know your child the best. In the first 2 years, the main focus of development remains on the motor achievements. हेड होल्डिंग, रोलिंग ओवर, सिटिंग, बच्चे ने कब बैठना शुरू किया, चलना शुरू किया, दौड़ना शुरू किया. Concerns about the child's responses, playfulness and emotionality are not obvious and are therefore easily missed. If you or your primary pediatrician have any concerns regarding the normal development of your child, further evaluation is necessary. The brain is very plastic in the first 3 to 5 years of life. Neuroplasticity means that it can be easily remodeled and we can teach the brain to make new connections. Therefore, the earlier autism is diagnosed and intervention started, the better is the outcome. Some of the early signs of autism are inconsistent and reduced use of eye contact. When you are trying to look at the child and you're talking to the child will not look at you directly. The child rarely smiles when looking at others. There is no exchange of back and forth warm, joyful expressions. You're trying to make funny faces, trying to involve your child, but the child will not be looking at you in the same manner. There is no spontaneous use of gestures like clapping when he's excited or waving bye-bye, salam, namaste. So these gestures are lacking. The child will not point to something he or she is interested in. So only for need-based tasks, the child will take you along to what the child needs. But if you try to show him, look, there's a cow, look, there's a dog, the child will not respond. The child usually tends to be content in his or her own world. So the parents usually say कि बच्चा अपने आप खेलता रहता है, खुश रहता है, पर ये है कि जब हम उसका नाम बुलाते हैं तो वो respond नहीं करता है. So the child is preoccupied with his own self. The most common concern which the parents come up with is speech delay. So speech delay is considered when there are no words by 16 months or no two-word phrases by 24 months. These children also tend to avoid or ignore other children. They might be odd or repetitive motor movements, which could be hand flapping, which could be rocking, spinning or jumping on the same spot. They also may have strong reactions to certain stimuli like sounds, lights or textures. So either it could be that they are very fascinated by loud sounds or by blinking lights or flashing lights. They would like to touch all the surfaces. They like to lick different surfaces. They might be mouthing everything. That means putting everything in their mouth even after the age of 2 years. Or it could be the reverse, that they are hypersensitive and therefore they tend to avoid. So they might put an ear to the sound, or they might not like musical toys at all. They might not like movement activities. They are scared of going on slides, or they are scared of going on the swing. So these are some of the things which children with autism have. When faced with the diagnosis of autism, one of the common questions which is asked by parents is, हमारे बच्चे को autism क्यों हुआ? There were no issues during pregnancy or childhood. हमारा पहला बच्चा भी बिल्कुल ठीक है. So why did our child get autism? Now this question is very obvious, but the answer is not as straightforward. Autism does have a genetic basis. We see it more commonly in siblings, but there is no one single gene which has been identified which is the cause of autism. Environmental factors have also been touted. So increased age of parents, toxins in the environment, and preterm or low birth weight babies are said to have increased incidence of autism. About 30 to 40% of children with autism, development is normal till 15 to 18 months of age. The child will develop gestures and speech. The child will start saying papa, mama, tata, and after which the child tends to stop or regress in Language development. Parents feel that this has happened because they were not very involved with their child and the child was exposed to a lot of screen time. Now, stimulation by parents when they're talking to the child, playing with the child, or singing lullabies definitely helps the child to learn and grow. But the lack of it will not cause autism. It will definitely increase the symptoms of autism, but it cannot be the cause of autism. Similarly, for screen time, excessive screen time has been shown to definitely cause an increase in the symptoms of autism. Pediatricians worldwide have come out with very strict guidelines about screen exposure. Screen exposure means exposure to all means of screen, which is TV, mobiles, iPads, laptops, everything. So from the age of 0 to 2 years, absolutely no screen time is recommended. Only some amount of video calls from relatives is what is allowed. Apart from that, there is no screen time. From the age of 2 to 5 years, 30 minutes, and from the age of 5 to 8 years, 1 hour of supervised screen time is recommended. On this day dedicated to spreading awareness on autism, our team at NeuroAid Research Facility, New Delhi, would like you to please accept autism. The sooner you accept that your child has autism, the earlier you will start working with your child, and that will give you tremendous results. Understand that no two children with autism will behave similarly, so do not compare. Train yourselves, equip yourselves with knowledge, know what the interventions and therapies will work best for your child, and these therapies and interventions, whether they are based on research and data collection. Include your child in the mainstream. Let them feel included in their schools and their community. Children with autism have their own unique skills. Identify and enhance these skills. Spread awareness. Talk to the other parents. Talk to your relatives. Autism is not a stigma. Motivate. Keep motivating yourself. Autism, unfortunately, is long term, and therefore you need to pace yourselves. There might be ups, there might be downs. Be happy with what your child is achieving. Set small goals for yourself and for your child. Take help from your family and well-wishers, and spread positivity.
Thank you and take care. For any further questions or queries, please feel free to connect with us at the NRF website. Thank you.